Hello, it's Dr. Rhonda Johnson. Today is Sunday, April 23rd, 2023, and today I am giving a personal message on women's reproductive health rights. You know, Dr. Martin Luther King said, "Our lives begin to end the day we become silent about things that matter." And this is something that matters to me that I have been silent on for far too long. Today, I end my silence. I support the position statement by the American College of Obstetricians and Gynecologists. Like all medical matters, decisions regarding abortion should be made by patients in consultation with their healthcare providers and without undue interference by outside parties. Like all patients, women obtaining abortion are entitled to privacy, dignity, respect, and support. Whether we like it or not, there are times when abortion is the only measure to preserve a woman's health or save her life. It is a well-known fact where abortion is illegal or highly restricted, women resort to unsafe means to end unwanted pregnancies. You know, I believe that the health care for women should be provided free of political interference and religious interference in the physician and patient relationship. The Supreme Court recently extended the access to misoprostol and mifepristone. Now, these are two drugs that have many different uses. In the United States, they have to be prescribed by a licensed healthcare providers, doctors and healthcare providers that are trained in the use of these drugs. And these efforts to limit or restrict the uses of these drugs by people with no medical training is shameful and needs to be stopped, because this will lead to unnecessary barriers to medically appropriate care. You know, I wish that every fertilized egg that implants itself in the uterus was desired and conceived in a loving way, but this is not always the case. There are situations where egg fertilization occurs in the setting of intoxication or drug addiction or forced abuse or rape or incest or adultery. And these are not situations where some politician or judge should be telling a woman what is best for her life. I personally believe that a woman has the right to choose what is best for her, period. It is not my place to tell a woman how to live her life, and it's not your place or anybody else's to tell her what choices she should make. We cannot go backwards in time. The United Nations Population Fund says globally, a staggering 45% of all abortions across the world are unsafe. And unsafe abortion is a leading cause of maternal death globally. And millions of women are hospitalized every year. Unsafe abortion can cause a woman to bleed to death, or she can get a pelvic infection that gets into her bloodstream that results in severe illness or death, or she can lose her uterus organ altogether. So to conclude, safe abortion care is health care, period. And we need to leave this between the woman and her health care provider. That's my message today. It's my opinion, and it's okay if you disagree with me. It's all right. I'm speaking my opinion. Take care and be safe.